I talk about lung transplant. Lung transplant is surgery to replace one or both deceased lungs with healthy lungs from a human donor. The donor tissues must be matched as closely as possible to your tissue type, and this reduces the chance that the body will reject the transplant.
The lungs are very fragile, and one of the difficulties is finding lungs that are in good enough health to pretty much ensure a successful transplant.
We are excited today that we're able to announce we've been able to perform the first breathing lung transplant in the Midwest. This is a technology that has been pioneered by a group in Boston. What it does is we are able to take donor lungs that we might have otherwise turned down and place them on a device to allow us to know when those lungs are ready to be transplanted. When the donor's lungs are removed from the donor, they're never kept on ice. They're kept in a breathing apparatus that allows blood to circulate and allows them to breathe. So it never takes them out of that natural habitat. We're able to take it on any plane, any jet, any ambulance. You can even take it in a car. It seems that the recovery might be a little bit shorter. It seems like they struggle just a little bit less. With those things together, we believe that the amount of wasted lungs is going to be reduced dramatically. And it is a real pivotal event in transplantation.
Application in medicine. Periodically take radiograph. Don't smoking. Maintain stable blood pressure pulmonary. Don't abuse alcohol and other drugs. Take appropriate treatment lungs problems such as asthma and EPOC.
In a tragic report, a woman recently passed away shortly after receiving a second chance at life. 27-year-old Jennifer Wetterell was diagnosed with cystic fibrosis at the age of 2. Her condition got progressively worse as she got older. Last year, she received a lung transplant at a London hospital. She passed away from cancer this past August, only 16 months after receiving the transplant. The lungs originally came from a middle-aged donor who was a heavy smoker. According to reports, Jennifer had not been informed that the lungs she would be receiving came from a smoker prior to the transplant. Jennifer's father stated, "All the risks were explained in the hour before her transplant, and not once was the fact smokers' lungs would be used mentioned. She was dying a death that was meant for someone else." The family refuses to let anger take them over. They have set up a Facebook page titled Jennifer's Choice, prompting more non-smokers to register as organ donors. Jennifer had gotten married in 2011, but her painful death stands out terribly in her family's mind. They hope.
Advantage and disadvantage. Advantage: have better lifestyle, live many years with healthy lungs. And disadvantage: the body may reject the transplant, damage to the kidney, liver, or other organs of the anti-rejection drugs, future appearance of certain cancers.
When you breathe, it's your lungs that are working. Air is pumped in and out of your lungs roughly 20,000 times every day. Thanks to your lungs, oxygen reaches your brain and your muscles, which keep you fit and healthy. If you've ever felt breathless or had difficulty breathing, you'll know it's not a nice feeling. You can take care of your lungs by opening windows to air out the room, or by going for a walk. This ensures that you get fresh air into your lungs every day. You're also helping your lungs if you exercise on a daily basis. If you smoke, the best thing you can do for your lungs is to quit. Smoking can harm your lungs to such an extent that they can become seriously damaged. If you cough a lot, there could be something wrong with your lungs. Having difficulty breathing could also be a sign that something is wrong. One indication that your lungs aren't as healthy as they could be is if you cough up thick phlegm, or even worse, blood. You You might also feel exhausted and find yourself stopping to rest all the time. Perhaps you avoid doing certain physical activities, such as using the stairs, carrying heavy shopping bags, or running because they make you feel breathless.
This is Christine Conti, who is the nurse navigator for lung cancer at Huntington Hospital. And these are actual lungs from pigs. And these lungs have been treated, one which looks pretty normal, and the other one to look like the lung of somebody who has smoked cigarettes for a long time. Now, the way that lungs work is the lung gets inflated when you take a breath in, and we'll show you how we inflate this lung. And if you look at them, they should look pink and delicate and sort of, I think they're lovely. You may not think they're so lovely, but as a lung surgeon, I think they're lovely. And you can just see how they expand and what a nice color they have, and that they just look healthy as they expand. Can you make that expand a little more? There it goes. So this is a lung that's been treated to look like a smoker's lung. And the difference between this one and this one, number one, obviously, is the color, because when you inhale smoke into your lungs, they tend to get a darker color. And this one is exaggerated a little bit, but it gets the point across. And the other thing about these lungs is that they're much stiffer. In other words, it takes a lot more pressure, a lot more effort when you breathe in to get those to inflate. Can you make those inflate? You can see,
Disease: cystic fibrosis, congenital defect, cough, interstitial lung disease, pulmonary hypertension, and asthma.
Chronic obstructive pulmonary disease, or COPD, is the gradual loss of your ability to breathe effectively. Normally, as you inhale, air moves freely through your trachea or windpipe, then through large tubes called bronchi, smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Normally, your airways and alveoli are flexible and springy. When you inhale, each air sac inflates like a small balloon.